I'm honored to join you at the plenary of the 66th session of the Commission on Narcotic Drugs. My statement reflects a consultation among scientists and community leaders on putting people, health and human rights at the center of the HIV response among people who use drugs. The overarching purpose of the global response to drugs should first and foremost be to ensure health, well-being, and security for all people, including people who use drugs, while always respecting their human rights. The evidence is well established and clear. Harm reduction works. Needle and syringe programs reduce the spread of HIV and viral hepatitis. Opioid agonist therapy treats opioid dependence, reduces vulnerability to infectious diseases, improves uptake of health and social services, and reduces all-cause mortality, including overdose and suicide. Naloxone is an effective treatment for opioid overdoses, saves lives, and can be safely delivered by families, friends, and peers. Now, despite this clear evidence, many countries continue to underutilize harm reduction, but instead rely on punitive and criminalizing approaches to drug use. Even in countries where harm reduction programs are implemented, availability is uneven, and accessibility and quality remain severely inadequate. Access is endangered when rights are not enforced. Compulsory drug detention and treatment programs violate international human rights, norms, and standards. And despite clear documentation of abuses, including forced labor, physical and gender-based violence, inadequate nutrition, and poor health care, these sites continue to exist. 11 years ago, 12 UN entities called for their closure globally. But the transition from compulsory detention to voluntary community-based services has stalled, and in some countries, even reversed. The criminalization of drug possession and use accounts for a significant proportion of the global prison population. Prison overcrowding, poor nutrition and ventilation, poor access to healthcare, and a lack of harm reduction programs exacerbate the crises of COVID-19, HIV, viral hepatitis, and TB. Reforming prison conditions is important, but people should not be incarcerated for drug possession or use in the first place. No policy or legislative reform process will be effective without the meaningful involvement and leadership of people who use drugs and their community-led organizations. They have the experience and expertise to craft policies and practices that actually benefit the communities they are intended to address. Alongside better data collection on the extent and variety of drug use, we need more reporting and monitoring of how human rights affect access to all health, HIV, and viral hepatitis services for people who use drugs. People who use drugs can take leading roles here too. Data on human rights and health access must cover both the community and prisons, and we call on member states to collect and publish this data. Countries that have moved away from criminalizing drug possession and use and invested in harm reduction have seen positive results. We have evidence, we have international commitments, but now we need action. Member states have the tools at their disposal to end criminalization, eliminate stigma and discrimination against people who use drugs, and to expand access to harm reduction and other life-saving interventions. Now is the time for serious commitment to put people who use drugs at the center of the HIV response and to support their rights and their health. I thank you for your attention.